welcome. If you're gearing up for your phlebotomy certification, you are in the perfect spot. Today, we're taking a deep dive into one of the most critical topics you will ever master, the pre-analytical phase. And trust me, this isn't just about passing an exam. It's about the very foundation of getting a diagnosis right and keeping patients safe.
Okay, let's just jump right in with a number that should really make you sit up and listen. Over 70%. That's how many laboratory errors happen before a sample even gets near a machine. It all happens in the pre-analytical phase, and that's the part that you control. So, if this is where most mistakes happen, who's on the front line stopping them? Well, the answer is you, the phlebotomist. You are the gatekeeper. You're the one standing between a potentially bad sample and a wrong diagnosis. Your skill, your attention to detail, that's what makes all the difference. So, to get you ready, we've laid out a clear roadmap for this explainer. First, we'll talk about the high stakes of your role. Then we'll build on the foundation of what's called the basal state. After that, we'll get into patient prep, different patient variables, look at some hidden things that can interfere with tests, and we'll wrap it all up with a checklist you've got to use every single day. Let's kick things off with Section 1, the high stakes of your role. Because what you do is so much more than just drawing blood. You're in a central position for the patient's entire diagnostic journey. So, what is the pre-analytical phase exactly? Well, it's basically every single step from the moment a doctor orders a test until that tube gets to the lab. We're talking patient ID, getting the patient ready, the collection itself, how you handle it, and how it gets transported. And like we said, it's where things are most likely to go sideways. What you do here directly impacts the quality of that final result. And this brings us to a super important point about being a professional. Your work carries real legal and ethical weight. As this note points out, if your communication or your documentation is poor, it can lead to a misdiagnosis, and that increases liability. So being careful and meticulous isn't just about being good at your job. It's about protecting your patient, your hospital, and yourself. Okay, let's move on to the scientific foundation for pretty much all lab work, the basal state. Understanding this concept is absolutely key to understanding why all that patient prep is so important. First off, we got to talk about reference ranges. You know, when a lab report says a result is normal, that just means it falls within a specific range of numbers. But here's the key phrase on this slide: standardized conditions. These ranges are created by testing a whole bunch of healthy people under very specific, controlled circumstances. Your job is to try and recreate those conditions with your patient. And what is that standardized condition? That's what we call the basal state. Think of it as the body's resting baseline state. It's usually in the morning, after the patient has fasted for about 12 hours, and before they've done any exercise or gotten stressed out. This is the perfect, clean state to collect a sample because it gives us the most stable and reliable results. Now, why does this matter so much? Well, this slide shows you perfectly. Just look at glucose. In that basal fasting state, it should be nice and low. But after you eat, of course it's going to be elevated. Same thing with triglycerides. If you draw from someone who just ate breakfast, their lipid panel might look really alarming, even if they're perfectly healthy. The context of the draw changes absolutely everything. And here is a huge takeaway for your certification exam. You have to connect these dots. Those normal ranges are based on the basal state. So if you collect a sample from someone who isn't in that state, their results might look abnormal. And what does that lead to? Potentially a whole lot of unnecessary follow-up tests, a ton of anxiety for the patient, and extra costs. This leads us perfectly into our next section, which is all about the practical side of your job. See, it's not enough to just know what the basal state is. You have to actively check and make sure your patient has actually followed the instructions. So before every single draw, there are a few key variables you have to check on. Have they been fasting for at least 8 to 12 hours? What's their posture? Are they sitting, standing, lying down? Have they done any tough workouts recently? And how are they feeling? Are they really anxious or upset? Every single one of these things can change the test results. Let's just focus on posture for a second, because it's actually pretty fascinating. When a patient goes from lying down, which we call supine, to standing up, gravity literally pulls some of the water out of their blood into their tissues. This makes everything left in the blood, like proteins and red cells, more concentrated by up to 10%. It's a huge change. So keeping the patient's position consistent is really key for getting results you can compare. And here is a critical error to watch out for during the draw. You might ask a patient to make a fist. but you have to tell them not to pump it over and over. That simple little action can actually squeeze potassium out of their muscle cells and into the bloodstream, making their potassium level look dangerously high in the sample. A high potassium is a critical panic level result that can set off a whole emergency response, all from a simple mistake. Okay, I know that's a lot to remember, so here's a super simple and powerful little memory tool for you. TPFA, timing of the draw, posture of the patient, their fasting status, and their recent activity. Just burn TPFA into your brain. Ask about it and document it for every single patient, every single time. All right, let's switch gears and talk about the factors that the patient can't control, but that you absolutely have to know about and document. These are the built-in variables that give us essential context for any lab result. Age is a huge one. What's perfectly normal for a grown-up can be a big red flag in a child, or vice versa. This table shows a few examples. Alkaline phosphatase, it's way high in kids because their bones are growing. Creatinine is super low in newborns because they have so little muscle. This is exactly why labs have different normal ranges for different ages. And here's a high-yield test prep alert related to age. For older adults, creatinine can be really misleading when we're checking kidney function. See, as we get older, we naturally lose muscle, and muscle is where creatinine comes from. So an older person might have a normal-looking creatinine level that's actually hiding some pretty significant kidney disease. And beyond age, there are other key variables, things like the patient's sex, that affects hemoglobin and creatinine. Pregnancy causes huge changes, like watering down the blood and ramping up clotting factors. Living at a high altitude? That'll increase your red blood cell count. And finally, some of the things we measure actually follow a daily rhythm. And that last point about daily rhythms is absolutely critical and very likely to pop up on your exam. For tests like cortisol and iron, which are highest in the morning and drop during the day, when you collect the sample is just as important as the number you get. If you don't write down the exact time of the draw, that result is basically useless. Okay, let's dive into Section 5, the hidden interferences. We're talking about drugs, supplements, and patient conditions that can physically or chemically mess with the lab tests themselves and give us a totally wrong answer. So many common medications can change test results. This table just gives you a few examples. Chemo lowers white blood cells. Aspirin makes people bleed longer, which is critical for you to know. But I want you to pay special attention to that last one, biotin, or vitamin B7. It's in tons of hair, skin, and nails supplements, and it can cause major problems with a whole category of tests called immunoassays, things like hormone tests. So, to help you remember how things like biotin cause issues, you can use the mnemonic CRUD. It stands for compounds reacting, unfortunately, as the desired analyte. What that really means is the test gets fooled. It sees the biotin, for example, and mistakes it for the hormone it's trying to measure. This can lead to results that are way too high or way too low. Now, besides the chemical stuff, there are interferences you can actually see with your own eyes. After you spin a blood tube down, you have to look at the serum or plasma. If it looks cloudy or milky, that's called lipemia, and it's usually from fat after a recent meal. If it's a dark yellow or brown color, that's Icarus, from high bilirubin. Both of these can mess up any test that needs to shine a light through the sample. And for your exam, it is crucial that you know the difference between these three visual problems. Lipemia, which is cloudy, icterus, which is dark yellow, and hemolysis, which is a red color from broken blood cells. They all have different causes and they mess up tests in different ways. Your job is to look at the sample, recognize these conditions, and document what you see. Whew, we have covered a lot of ground. So now, let's bring it all together. Let's put it into one final actionable checklist. I want you to think of this as your pre-flight check that you do before every single draw. Here it is, your non-negotiable checklist. You always start with patient ID. Then you confirm and document TPFA. You write down the exact time of the draw. You ask about and record their medications, especially things like biotin or blood thinners. You note the context, like their age or if they're pregnant. You look at the sample after you collect it. And most importantly, if anything is different from the normal procedure, you communicate it. If you remember only one thing from our entire time together today, please let it be this. The context is part of the specimen. A tube of blood by itself, without all that information, it's incomplete. Your documentation about the time, the patient's prep, their meds is every bit as critical to getting the right diagnosis as the physical draw itself. So I'll leave you with this question to think about as you keep studying and as you start your career.
When you hold that tube, are you just holding a tube of blood? Or are you holding a patient's diagnosis, their treatment plan, their future in your hands? Your attention to all these pre-analytical details is what makes all the difference in the world.